Welcome back to In Focus, and of course it's now time for our In Focus health segment with correspondent Moudou. Just days before the International AIDS Conference in Vienna, Linord, some good news from the United Nations.
Yes, Dimiake, the United Nations says the number of young Africans becoming infected with the AIDS virus is falling thanks to better use of prevention measures. The UNAIDS agency reports young people in Africa are waiting longer to have sex, having fewer sexual partners, and increasingly using condoms. As a result, the agency says the prevalence of HIV is falling in 16 of the 25 hardest hit countries in Africa. The biggest drop was in Kenya, where the infection rate among 15 to 24-year-olds dropped by 60%. The report says Botswana, Ivory Coast, Ethiopia, Malawi, Namibia, and Zimbabwe have all reduced their number of AIDS cases among young people by 25%. Experts and AIDS activists are gathering in Vienna for the 18th International Conference on AIDS. Scientists have learned a lot about HIV/AIDS since 1985 when the first conference was held, but there is still no cure. Voice of America's Carol Pearson has more.
In many countries, AIDS sufferers are shunned, as are those with tuberculosis. Many with HIV, the virus that causes AIDS, also have TB, a dangerous and easily transmitted disease. Dr. Helen Bygrave works at a clinic in Lesotho.
Of all our TB patients, between 80 to 90% of them also have HIV.
Others with HIV are shunned because the disease is viewed through the lens of morality and religion. Suskma Ratri, an AIDS activist, says AIDS does not recognize faith or morals.
I was representing the group that was in my country was seen as the safe group because I was loyal to my husband. I was not doing any risky business, no monkey business. I was living like a very straight life, but I'm HIV positive.
Even in Islamic countries, the number of people with HIV is small but growing, according to a new United Nations report. The report says AIDS exists in the Middle East and North Africa, primarily among IV drug users, men who have sex with men, and prostitutes, people shunned by many societies. The Vienna conference will focus on the rights of people with HIV and AIDS. Before leaving for the conference, Dr. Eric Gooseby, the U.S. Global AIDS Coordinator, told VOA that attitudes about people who engage in high-risk behavior need to change so AIDS can be contained.
These individuals are frequently not willing to reveal themselves to medical institutions and therefore come into care much later, in much later stages of HIV, usually when they start to present with opportunistic infection.
AIDS experts say in addition to the stigma and discrimination, cultural norms are major obstacles to containing HIV/AIDS.
Must be talking to an angel. Must be talking to an angel. Must be talking to an angel. Oh, yeah.
Performing artist and activist Annie Lennox spoke earlier this year when the UN launched a plan to address gender inequality and human rights violations that put women and girls at greater risk of HIV infection.
Women of reproductive age are actually at the forefront of risk in the HIV/AIDS spread. They are the ones that need to be addressed.
Although women and girls make up 50% of global infections, they account for nearly 60% of those living with HIV in sub-Saharan Africa. In southern Africa, young women are 3 times more vulnerable to HIV/AIDS than men. Dr. Anthony Fauci says empowering women is crucial to slowing the spread of HIV/AIDS.
Women in many of these countries don't have the right to protect themselves against infection.
Health officials also want illegal drug use decriminalized so IV drug users can obtain clean needles and medical attention. Experts say policies that punish high-risk behaviors fuel the spread of AIDS. 2010 is the deadline set by global leaders to achieve universal access to HIV prevention, treatment, and care. These goals will not be met, but AIDS activists hope that with a focus on human rights, more people will receive treatment, and with better access, the disease can become better contained. Carol Pearson, VOA News.
One of the issues on the agenda for the AIDS conference is HIV and human rights. Joining us is Katherine Fritz with the International Center for Research on Women. Welcome to the program, Dr. Fritz.
Thank you.
Well, let me have your take on the issue of HIV/AIDS as it relates to human rights.
Well, human rights are a powerful driver of HIV transmission everywhere in the world. And when we talk about human rights violations, we're really talking about systemic, prolonged discrimination against often people by their ethnic identity or their sexual orientation. But the most common form of human rights violation experienced the world over is the gender inequality that women experience.
And speaking of women's issue, we know that women are definitely at the forefront, one of the most affected population when it comes to HIV/AIDS. Tell us about what the issues are. We hear about violence against women. We hear about lack of access to information. Tell us about some of the issues that should be on the agenda during the conference. Mm-hmm.
Well, the barriers that women face are quite diverse. They're economic, but they also fall into the realm of education. Basically, women the barriers that women face include lack of access to employment, education, and property rights. And these are all aspects that need to be taken into account in an AIDS response.
Now, looking at the solutions, what would you suggest as someone who is really involved into this issue?
Well, there are four main things that really need to be done and need to be part of any comprehensive AIDS response if it's meant to respond to women's needs. The first thing that needs to be done is there needs to be comprehensive health care programs for women that respect women's needs and women's time. So that means integration of maternal health, of reproductive health, of family planning, and HIV treatment and prevention programs. And that's beginning to happen, and it's extremely, extremely encouraging. But in addition to that, that's necessary but not sufficient. In addition to that, we need very powerful and sustained community-based programs that help men and women, boys and girls, to overcome the gender norms that are creating the very inequality that then drives the women's risk of HIV infection. In addition, we need to address legislation, and we need leaders to step up to the plate and support legislation and its enforcement that protects women from violence.
And what type of legislation would you say needs to be implemented, whether it's regarding violence or even health?
Well, the types of legislation that are needed include protection of women's property rights and access to capital and credit. Often those laws exist, but they're not enforced. And many, many women, thousands of women every year in Africa become dispossessed from their property and their access to livelihoods because their husbands die of HIV. In addition, we need actually more enforcement of existing laws to protect women from abuse, sexual abuse, and domestic abuse within their relationships.
And in 10 seconds, how can men be partners in helping women combat HIV/AIDS?
It's absolutely crucial that men be partners. And there are many innovative programs taking place even now that are bringing men into the process and transforming men's gender norms as well as women's.
Thank you so much, Dr. Fritz, for joining us today.
Thank you.
And that's your health report for today. Dimiake, back to you.